I thank the people who are clapping for us. They are amazing people. I thank them because they appreciate what we are doing.
But beyond the clapping, how much do the carers think we care?
I don't think we feel valued. I don't think so.
Vivian is a care worker in a home for the elderly. Her place of work, she says, now terrifying for staff and residents alike.
People are dying. You don't know who is catching it, and the risk is high at this moment.
She says there hasn't been enough PPE at work, and then she must come home here to just one room she shares with her young son, their whole life in here.
I feel sad. I feel sad when I just watch the TV and it says social distancing. Isolate yourself. How do you isolate yourself in such environment? Even if, let's say, I have a cough, where do I hide myself from my son? It's not possible.
This is where they eat and sleep and where her son does his homework. His teacher brought him new books because the local library is closed. This isn't temporary housing. They've been here for 3 years. Vivian earns the minimum wage, a little over if she works nights and weekends. But for the work you are doing, you should not be living like this.
No. 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 No, Jackie. No.
So Vivian lives in that one room, sharing a bed with her son and a kitchen and a bathroom with 10 other adults and several children. She pays £600 a month for the privilege. That's more than half her monthly salary as a carer. One of the people we turn out and clap for every week. Care worker pay has gone up 7% in real terms since 2015, according to the King's Fund, due to the introduction of living wage legislation. By last year, that meant the typical independent sector care worker earning around £8.10 an hour, less than most supermarket workers. Carolina Gerlich is a former care worker now running the Care Workers charity. With so many workers self-isolating, relying only on statutory sick pay, the charity has given out more crisis payments in the last 6 weeks than in the whole of last year.
Care workers are desperate for financial support and desperate for recognition and being better supported with PPE, with testing and with community support.
So when care workers tell us they feel like second-class citizens, do you agree with them?
Well, second class, that would probably be even overestimating that. Third class citizens, I would say, compared to the NHS.
I thought I was dying. At some point, really, I thought I was going to die. In fact, I'm shocked I'm even seated here now.
Tabitha says when COVID started spreading within her care home, no one was prepared. She believes she became infected very quickly.
I couldn't breathe. I could not speak. Jackie, if you called me at that time, I could not have spoken to you for more than 10 seconds.
Tabitha spent 28 days off sick with COVID-19 symptoms, forced to rely on charity for help.
Hare Krishna started bringing for me lunch every single day. And to be sincere, if it were not for that meal, if it were not for their charity, I would not also be seated here.
Since returning to work, she often walks an hour both ways as she can't afford public transport. There is now more PPE, she says. For her, the quality of it speaks volumes.
You know, there's a difference between being given something that is worthwhile and something for the sake of saying you've been given. So as you walk with the bus, 1 or 2 buses passing you by, you wonder, is it worth it? Is this job worth it?
Robert Stevenson Padron provides home care services and has long campaigned for better pay for care workers, paying his own £2 an hour more than the average.
I think if you are in poverty and the option is going to work when sick or not being able to pay your rent, I think a lot of workers in poverty are going to feel compelled to go to work even when when they shouldn't. The way social care workers have been treated during this pandemic has been awful, but it's been awful for many, many, many years. The big difference between now and before the pandemic is now the injustices against social care workers put them at risk, causing them to die.
Vivian wants to keep working with the residents she loves and regards as family. But she also wants to be able to give her real family, her son, a better life.
I would dream to have a nice house or a place that is good for my son to have a place to sleep, a place to do homework. When my son is happy, Mom, I will be also happy. That's my dream, to see my son happy.
Jackie Long reporting. So, how do we protect care home workers and residents? Well, yesterday the Prime Minister announced a £600 million fund for infection control in care homes in England. One area the government has prioritised is making sure the patients are at least tested negative for COVID-19 before being discharged from hospital to care homes. But is that system working as it should? Our chief correspondent, Alex Thompson, has this report.
Blackpool, and tonight eyewitness evidence that casts doubt on the government's pledge that only people who test negative can be discharged into care homes from hospital.
I wanted to share something with you guys that is extremely worrying and concerning to me and to many of my fellow colleagues.
Once more, it's what those at the front lines see happening against what the government claims is happening.
We had a resident discharged back to our care. This resident had been in hospital for a non-COVID related issue. We were told there was no COVID test results available at the time of discharge, but the person had been swabbed. Within 24 hours, we received a call to say that this person's results had come back and they were now COVID positive.
All this, as evidence this week in the Health Service Journal, shows tens of thousands of COVID testing results are being lost, apparently through a technical glitch in the system. Such data is vital to local health organisations, of course, to set up test, trace and contain strategies. No data, no strategy.
I think it sort of shows the problems that can crop up when you're running the system in quite a fragmented way, where you've got, the NHS and Public Health England doing one thing, you've got consultancy running the drive-through centres, you've got the army delivering tests, you've got tests being posted through the post. So it's quite a fragmented system.
Which all came to light in an internal NHS update email stating there was no end in sight to the problem.
The email that we saw was sent out to various health and care professionals locally, so for example public health staff, and it said that there would be incomplete data for some time, until further notice was the phrase they used, because of the technical problems that have emerged.
The Department of Health say the technical issue is resolved, didn't interfere with people getting results, and the vast majority get them anyway within 48 hours. Transport Secretary Grant Shapps at tonight's media briefing repeating the right in England for all care home staff and residents to be tested.
Everybody in a care home, that doesn't matter whether that is a care home worker or a resident, and it doesn't matter whether they are symptomatic or asymptomatic, can now be tested.
All of this, more fuel on the ever-heating debate that the entire care home sector has, for too long, been too neglected by too many governments.
It's just a human tragedy, and we have not tackled this as a nation. So my charge back now to the entire political class, and especially, of course, the government, is that we've got to find a settlement and a way forward that not only overcomes underfunding, but actually enables people on the ground to provide a seamless service and to recognise that the value of somebody in a care home is exactly the same as somebody in a hospital ward.
In the past hour, the Department of Health said we are instituting a policy of testing all residents prior to admission to care homes.
Scotland's social care watchdog has started legal action against the owners of a home in Skye where 30 of the 34 residents tested positive for coronavirus and several of them died. The Care Inspectorate for Scotland has applied to court to cancel the registration of Home Farm Care Home in Portree, which is run by the UK's largest operator, HC1. The Inspectorate said it was working to find alternative housing for the home's residents. HC1 said it was disappointed at the action and said it was working with the NHS to keep residents and staff safe.
Well, we're joined now by the Labour MP Helen Hayes, who is the Deputy Chair of the All-Party Parliamentary Group on Social Care. Helen Hayes, the great cliché has always been that social care is the Cinderella service, but this crisis has certainly proved that. I'm wondering if you think most MPs really ever knew that.
Well, the evidence that social care has been undervalued and underfunded for at least the last decade has been known. There has been a huge amount of work in Parliament, both on a cross-party basis and by individual political parties and by the social care sector itself, that demonstrates that it is underfunded, that staff are underpaid, that there is a problem with job security, and that the sector is not delivering for many people who are entitled to care and who need care. And to hear those stories tonight of care workers living below the breadline whilst doing some of the most important, most valuable work during this pandemic is heartbreaking and frankly outrageous. And nobody in government can say that they didn't know that this was going to be the case. 2 years ago, the directors of adult social care from local authorities wrote to the government to say that the sector was ill prepared for a pandemic and set out a series of actions that needed to be taken to get to that state of preparedness. And no action was taken. And this is now where we find ourselves, with care workers living in poverty, with residents in care homes dying, with workers in care homes dying at twice the rate.
If all that was known, why wasn't any planning done for how social care would respond to COVID-19?
Well, I can't account for why the government didn't act on that report. But I can say, as somebody who sat for the last 5 years on the Housing, Communities and Local Government Select Committee and as co-chair of the APPG for adult social care, that there is enormous frustration that the government has been kicking the social care can down the road. We know that social care is underfunded to the tune of around £3 billion. We know that there are 1 million people who need care who aren't receiving any care at all, and that a crisis like this was going to push the sector to breaking point. The government has known this. It has delayed publishing the much promised green paper on adult social care. It delayed bringing forward funding.
Forgive me interrupting, because there has been a development today. The government says that most of these homes, if not all of these social care homes, are now COVID-free. Do you believe that? Do you even know it?
So that isn't the evidence that I have. We've been doing a conference call once a week with the working group for the APPG on adult social care, which is widely drawn from across the sector. Nobody in that group is saying that this crisis has passed and that care homes are COVID-free. Some of the measures and the funding that the government announced yesterday, the funding is welcome, but it was called for 2 months ago. At the beginning of this pandemic, care homes were calling for personal protection.
Forgive me interrupting you again. I'm sorry, but this crisis is so grave. I must press you on this. I mean, the crisis is so bad that one wonders why there isn't an absolute emergency funding. 600 million is going to go nowhere if you're talking about 3 billion needed.
Yes, I mean, absolutely right. We need comprehensive reform of social care to deliver a system which values staff properly and pays staff properly and can deliver the quality of care in each and every setting. I wrote to the Secretary of State on the 14th of March calling for funding to make sure that any care home worker who needed to self-isolate could do so on full pay. And we hear the story tonight of somebody who was off sick for a month, who was forced to rely on charity to feed herself. The government has known about these problems and has failed to act until it is too late.